volumetric scene allows users to interact with real patient scans, such as this hand CT in front of us, that you will be using for your following activity. As a reminder, let's review some of the basic functions that'll help us explore this scan, such as this yellow slider to help us window our tissues. Again, being able to pull out some of those tendons of flexor digitorum superficialis and flexor digitorum profundus just deep to that. We can also pull out this transverse carpal ligament and some of those structures as they move into the hand, such as your lumbricals and interosseous muscles. Again, simply sliding down these min and max sliders to window the data. You can pull out different muscle bellies as well as their tendons on both the flexor and extensor side. Again, work with those sliders to be able to appreciate different structures of your activity. Additionally, we also want you to be mindful of our cross-section, seen by this icon here, used when you can overlay on a scan, and pay attention to our light blue slider here, which is our tissue transparency slider. You can turn that all the way down and pan through the entirety of the forearm to help appreciate some of those structures, again, as we move into our carpals and beyond, distally into the hand. Playing with different levels of transparency allow you to see different spatial relationships. But keep in mind, with the wrist and pronation and supination, the orientation of your cross sections in the volumetric scene may not always match perfectly of that in the models. Simply pay attention to trying to identify structures and understand the spatial relationships of these cross sections throughout your activity. Again, being able to window your data set using your density and transparency sliders to better understand the spatial relationships on our cross sections.